Joint pain is a common complaint, but when it affects multiple joints, it can be challenging to pinpoint the cause. The pain may be widespread, chronic, or even associated with poor sleep and fatigue. Some people experience pain after activity while others feel worse after periods of rest. It's important to distinguish between inflammatory and degenerative joint pain, as this guides both diagnosis and management. Inflammatory pain, such as that seen in rheumatoid arthritis or psoriatic arthritis, often presents with morning stiffness lasting more than 30 minutes and may be accompanied by night pain or systemic symptoms like fatigue and fever. On the other hand, degenerative pain, such as osteoarthritis, typically worsens with use and improves with rest, with minimal morning stiffness. Recognizing these patterns is the first step in understanding what's happening inside the joint. Accurately diagnose joint pain. Clinicians look for specific features that differentiate inflammatory from degenerative causes. Inflammatory joint pain is often acute or subacute in onset, with symptoms like soft tissue swelling, effusions, and systemic signs such as fatigue or fever. Conditions like rheumatoid arthritis, psoriatic arthritis, and gout fall into this category. Degenerative pain, on the other hand, is more chronic, with bony swelling and symptoms that worsen after use. Osteoarthritis is the classic example. Diagnostic tips include assessing the pattern of joint involvement, symmetrical or asymmetrical monoarthritis or polyarthritis, and considering age, gender, and associated clues like Raynaud's syndrome or psoriasis. Blood tests such as ESR, CRP, and rheumatoid factor, along with imaging like X-rays and ultrasound, help confirm the diagnosis and rule out other serious conditions. Once the clinical features are identified, targeted investigations are essential. Blood tests like full blood count, ESR, CRP, and specific antibodies such as rheumatoid factor and CCP antibody are commonly used. Imaging including X-rays and ultrasound helps visualize joint changes. In some cases, advanced imaging like MRI may be needed, especially for spinal pain. Special types of joint pain, such as those caused by crystal arthropathies like gout and pseudogout, have unique features and require specific diagnostic approaches. For example, gout often presents as acute monoarthritis, commonly affecting the big toe or knee, and is confirmed by identifying urate crystals. Pseudogout, on the other hand, involves calcium pyrophosphate crystals. Recognizing these patterns and using the right tests ensures accurate diagnosis and effective management. Spinal pain can be particularly challenging to assess, as it may be due to mechanical or inflammatory causes. Mechanical back pain is usually related to activity and improves with rest, while inflammatory spinal pain, such as in spondyloarthritis, often presents with morning stiffness, improvement with exercise, and may be associated with extraarticular features like uveitis or inflammatory bowel disease. Assessment of Spondyloarthritis International Society (ASAS) criteria help clinicians identify inflammatory back pain. Investigations may include HLA-B27 testing, MRI of the lumbar spine, and blood markers of inflammation. Recognizing these differences is crucial for early diagnosis and appropriate treatment, as inflammatory spinal conditions can lead to significant disability if not managed promptly. In summary, evaluating multiple joint pain requires a systematic approach that considers clinical features, patient history, and targeted investigations. Distinguishing between inflammatory and degenerative causes is key, as it guides further testing and management. Blood tests, imaging, and sometimes genetic markers like HLA-B27 all play a role in reaching a diagnosis. Special attention should be given to red flag symptoms such as night pain and systemic features, which may indicate more serious underlying conditions. By understanding the patterns and using a structured approach, clinicians can provide more accurate diagnoses and better outcomes for patients experiencing joint pain.